Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Do you have thyroid issues? It's estimated about 20 million Americans do have thyroid disease. So how do you know if you have it, and what does that mean for your health? We're talking with ear, nose, and throat doctor, Dr. Mark Sheridan, about that today on Monday Health Minutes. Thanks for being here.
Oh, you're welcome. Thank you.
This is a really important topic because there are a lot of people that this can affect.
Absolutely.
So let's talk about what the thyroid is and how it's so important to your health.
So the thyroid is what we call the second master gland, and it helps control all the metabolism in your body. So digestion, how your energy levels. For women, it also, more importantly, does control your menstrual cycle, and that's a big deal for females. So if that's out of whack, the thyroid, then that can affect your cycle or even getting pregnant, those kind of things. So it's very important. It helps our hair grow, helps, it really is, like I said, there's one other gland up in the brain that's a little bit more important, but the thyroid's the second master gland.
I like that, second master gland. So it really is so important for our overall everything. What gives you an idea that you have a thyroid problem?
Well, there's a couple of things. If it's underactive, you'll be cold all the time, potentially. You'll gain weight. Now, everybody always wants the thyroid to be the answer, and it is sometimes, but not all the time. But it can be a weight gain. Hair can fall out, brittle nails, breaking easy. Your skin will get all dried out and not feel normal. So those are a couple of just minor symptoms we talked about. For women, it can be an irregularity that starts happening with your monthly cycle.
Mm-hmm. And how about for men?
For men, mostly it can be an energy level thing, and really for guys, the thyroid, when that's if there's a metabolic issue. For men, they'll actually end up feeling a lump in their neck, and that usually is a nodule.
Okay, so let's talk about nodule. What exactly is that, and how does that manifest itself? How do those develop?
So they can be just genetic, and they can be from bad diet. So everybody, Morton's salt, the little umbrella. Mm-hmm. So that has iodine in it. Iodine is very important for helping metabolize the thyroid hormones, helping us to secrete that. And what happens is sometimes you just get an overgrowth. One area, the thyroid will sort of think about building a muscle that shouldn't be built, but it does. Some people diet, it's trying to create this hormone because your diet's not right, and it will create these lumpy bumps.
And then that's when you know you've got a nodule.
Well, sometimes guys will be shaving, they'll reach up and they'll feel it. A lot of times just women, when they go for exams, usually your OBGYN will feel their neck because the thyroid's important, and they'll feel the lump. And the thyroid lives sort of down in the lower part of the neck here, and you can feel it. They'll swallow. A lot of people want to think, oh, I have any trouble swallowing. It has to be my thyroid. That's unusual. It can be, but it's an unusual thing that the thyroid's causing the swallowing issue. But that's how it usually manifests itself. Is somebody will feel it, or you'll see it. You'll look in the mirror and you go, something doesn't look right. Not sure what it is, but it just doesn't look right.
And that's when you should seek medical attention.
Absolutely.
And have it checked out.
Start with your primary care physician or your OBGYN, and just say, hey, I feel this. Is that me, or what is this? Because there's other lumps and bumps that happen that don't mean anything, that's where you start. And then might draw some labs to see if it's functioning correctly, and then maybe an ultrasound to see if there is a nodule there. Or sometimes, actually, I've seen patients where they're not quite symmetric. None of us are, and the thyroid's just more anterior on one side, the other. It looks like a lump, and it's not really. But that's exception to the rule. But so you better to have that checked out than to let it go.
Let's talk a little bit more about the nodules. They can be benign, and they can also be malignant.
So thankfully, most of them are benign. But they should be, if they hit a certain size, typically about 1.5 centimeters, or if they have certain characteristics on the ultrasound, we recommend a biopsy, which just involves sort of numbing up the skin a little bit and sticking a needle in there a couple of times to aspirate some cells.
And then what treatment options are available if it does prove to be malignant?
So if it's malignant, almost always needs to come out, and it's surgery.
And how about lifestyle changes? How important is lifestyle to having a healthy thyroid?
Oh, absolutely. You want a good diet, popping chips all day is not a good idea.
Darn it.
Yeah, you and me both. Good exercise, trying to stay healthy, sleeping well, all those things are important.
All right. The second and most important master gland.
Absolutely.
The thyroid. All right. Dr. Sheridan, thanks so much for explaining it all to us.
Thank you.
Thanks for checking in on Monday Health Minutes.